Abdominal and pelvic CT scan with contrast. An abdominal and pelvic CT scan with contrast is an essential medical imaging technique that allows doctors to visualize the internal structures of the organs in the abdomen and pelvis. This technique uses a contrast agent, a special medication that enhances the contrast of tissues on the images. AL. Applications of the technique: early detection of venous aneurysm. The technique helps detect early abnormalities in the venous system, especially venous aneurysms, enabling timely diagnosis and treatment. Applications of the technique: detecting blood flow disturbances in solid organ parenchyma. The contrast agent helps clearly identify the level of blood flow to the organs, allowing diagnosis of pathologies like blood vessel blockages and ischemia. Applications of the technique: assessing the vascularity of tumor lesions. The contrast agent helps differentiate between benign and malignant tumor lesions based on their blood flow levels. Applications of the technique: detecting vascular malformations in the gastrointestinal tract. The technique helps identify abnormalities in the blood vessel structure of the gastrointestinal tract, especially vascular malformations. Applications of the technique: active bleeding due to organ trauma causing extravasation of contrast agent. The contrast agent helps pinpoint the location and severity of bleeding, aiding in timely treatment. Stages of scanning: arterial phase performed after injecting the contrast agent into the artery. It helps assess blood flow in the arteries, detecting abnormalities like stenosis, occlusions, and aneurysms. Stages of scanning: venous phase performed 6070 seconds after the contrast agent injection. It helps evaluate blood flow in the veins. This technique allows assessing the rapid or slow elimination of the agent in tumor lesions, helps accurately diagnose the nature of the lesion. Stages of scanning: clearly showing lesions like rupture lines in organs, bruised lesions, helps doctors develop suitable treatment plans. Assessing the rapid or slow elimination of the agent in tumor lesions helps accurately diagnose the nature of the lesion. Stages of scanning: clearly showing lesions like rupture lines in organs, bruised lesions, helps doctors develop suitable treatment plans. Delayed phase performed after a certain time depending on the specific case of each patient. It helps evaluate the tissue recovery and organ function after treatment. Stages of scanning: assessing the rapid or slow elimination of the agent in tumor lesions helps accurately diagnose the nature of the lesion. Clearly showing lesions like rupture lines in organs, bruised lesions, helps doctors develop suitable treatment plans. Precautions: although an abdominal and pelvic CT scan with contrast is a safe procedure, it can still cause some side effects, mainly allergic reactions to the contrast agent. Precautions: patients should inform their doctor if they have a history of allergies to contrast agents, kidney disease, diabetes, heart failure, or pregnancy. Patients should fast for 46 hours before the scan. Patients should drink plenty of water after the scan to eliminate the contrast agent from the body. Precautions: patients who do not cooperate during the procedure can affect image quality and may require a repeat scan. Conclusion. An abdominal and pelvic CT scan with contrast is an important diagnostic imaging technique, allowing doctors to clearly identify the structure and function of organs in the abdomen and pelvis. This technique has various applications in diagnosing and treating pathologies in the abdomen and pelvis. However, patients should inform their doctor about their health status before undergoing the scan to ensure safety and effectiveness for diagnosis and treatment.